Pharmacology can be defined as the study of drugs that deals the different therapeutic uses and toxicology, but mostly it can be divided into pharmacokinetics and pharmacodynamics, two different branches. As we know, pharmacokinetics deals about the movement of the drugs that covers ADME, and the major parameters over pharmacokinetics are bioavailability, volume of distributions, clearance, and half-life. That means time per plasma drug concentration that is reduced to 50% of the initial drug concentration. Here on pharmacodynamics, we can discuss about the impacts shown by the drugs to the biological system. That may be through different receptor binding, enzyme inhibition, or ion channel modulations. On pharmacodynamics, the major parameter are dose-response relationship. That is depends upon potency and efficacy of the drug. And one of the most important parameter that is to be discussed over here is therapeutic index, which shows the margin, safety margin, and makes us sure about the drug safety. And furthermore, there are different receptor theories. There are agonist, antagonist, and partial agonist, which are discussed under pharmacodynamics. Now we will be discussing about factors affecting the pharmacokinetics as well as pharmacodynamics. There are mainly three parameters that affects over the kinetics and dynamics of the drugs. They are physiochemical factors, physiological factors, and pharmaceutical factors. On physiochemical factors, there are sub-factors like solubility, ionization, molecular size, and stability, which impacts on the pharmacokinetics as well as dynamics of the drugs. On physiological factors, the age, which is one of the major factors that impacts on the pharmacokinetics as well as dynamics. As on neonates, there is immature liver and kidney function, whereas on elderly people there is reduced clearance. They both impacts on the both parameters, that kinetics as well as dynamics. Similarly, the body weight and composition also alter the volume of distributions that may lead to the differentiation on kinetics as well as dynamics impacts of the drug over the biological system. Another factor is organ function. That means the hepatic as well as renal functions. If there is alternation or impairment on both parameters, they also lead to the impairments or the changes in metabolism and excretion, which directly leads to the deviation of the kinetics as well as dynamics impacts of the drug. Another is the blood flow, and next one is genetics. Genetically also there are some factors. One of the last factor is pharmaceutical factors that cause impacts on both dynamic as well as kinetics of the drugs, in which dosage form also causes the impacts on their different parameters, whereas the dosage form can be formulated on tablets, injections, or syrups, as well as other types of formulation, spray, and so on. Next one is excipient, on which the excipients plays a major role in the dissolution rate that may retard the dissolution rate, which ultimately impacts on the kinetics as well as dynamics of the drugs. Next one is the formulation technology. That means that there we can formulate the different types of drug in different types of dosage forms. That may be the sustained release, controlled release, or immediate release, which ultimately cause impacts on the dynamics as well as kinetics of the drugs. Next one is route of administration. That may be oral or intravenous or subcutaneous, as well as transdermal or maybe inhalational. These all also cause the alternation over there. And one of the last factor is drug interaction. That may be food or other drug altering that absorption, metabolism, or excretion. In this way, these factors affects the drug pharmacokinetics and pharmacodynamics, which ultimately cause the alternation in their impacts on the body. Thank you. Hope you get some ideas about the pharmacokinetics and dynamics from this video. Thank you.